Hello, welcome to Designed for Recovery, a global platform where architecture, empathy, and empirical evidence converge to shape the environment that facilitates healing. I am your host, Lowo Adeyemi, healthcare architect and advocate for design that reinstate dignity, bolster recovery, and promote equity. Today, we will delve into a pivotal yet frequently neglected nexus in the continuum of care: transitional care facilities, those intermediary spaces that assist patients in their transition from hospital to home. They occupy a unique position, neither acute care, hospital, nor traditional residential setting. Instead, they are meticulously crafted to support short term rehabilitation and recovery following an illness, injury, or surgical procedure, serving as a critical junction where design can profoundly influence the balance between relapse and recovery. Let us commence with the rationale. When a patient is discharged from a hospital yet remain unprepared to return home, they frequently transition to a post-acute care facility, particularly if they necessitate ongoing monitoring, physical rehabilitation, or assistance with daily activities. This facility may encompass rehabilitation center, skilled nursing establishments, or step-down units within healthcare campuses. However, herein lies the challenge. Many of these environments are either excessively institutional or overly unstructured, failing to meet the nuanced needs of patients during this delicate phase. Research indicates that inadequate transition from hospital to home can precipitate adverse events, hospital readmission, medication error, and even preventable fatalities. Indeed, nearly 1 in 5 Medicare patients discharged from hospitals experience readmission within 30 days. That statistics alone constitutes a design challenge warranting our immediate attention. So, what is the solution? Transitional care environments that harmoniously integrate the comforting essence of residential warmth with the precision of clinical efficiency. Environments that alleviate anxiety, promote mobility, nurture autonomy, and above all, cultivate an atmosphere conducive to healing. Designing transitional spaces necessitates a delicate balance between clinical functionality and residential comfort, presenting an accelerating design challenge. Let's go through few highlights that can guide our approach in this endeavor. The first of these is residential scale layout. Rather than elongated institutional corridor, envision cluster of private or semi-private room organized around a communal lounge, dining areas, and therapy spaces. The objective is to cultivate a neighborhood ambience as opposed to a hospital ward. The second highlight to consider is natural material and color palette. Warm wood tone, gentle lighting, earthy paint hue, and textured fabric contribute to a homely atmosphere. However, these elements must be harmoniously integrated with durable, easily maintainable, and infection control compliant material. We should also consider integrating biophilic design. because access to nature, whether through garden courtyard, indoor greenery, or expansive view of the outdoor, exert a profound influence on mood and recovery. In transitional care, mobility is progressively regained. Healing garden can facilitate safe, supported movement. We should also consider integrated therapy spaces. Therapy should transcend the confine of clinical appointments. It ought to be an intricate aspect of the environment. Consider therapy gym, adorned with expansive windows, functional training kitchen, and outdoor walking path equipped with handrails and resting spots. And lastly, personalization and autonomy is of importance. Patients should possess the ability to regulate light, temperature, and entertainment within their rooms. Even modest gestures such as displaying personal photographs or establishing family routine can alleviate stress and bolster cognitive recovery. Let us envision a transitional center meticulously crafted for orthopedic patients in the aftermath of surgery. Rather than relegating patients to a sterile, uninspiring recovery wing, they are graciously welcomed into a recovery house. Each room is meticulously designed with expansive doorways, sleep-resistant flooring, motorized blinds, and fully accessible bathrooms, not solely for safety, but also for the practice of daily activities. Rehabilitation therapy is not just located down the hall, it is intricately woven into the living environment. The kitchen transformed into a training ground for meal preparation, while the garden serves as an integral component of mobility therapy. Additionally, caregiver, both professional and familiar, are actively engaged in care planning within the facility itself. Technology plays a pivotal role as well. For example, smart sensor diligently monitor fall risk. Also, voice activated controls provide assistance for those with limited mobility. Telehealth nodes facilitate connections between patients and specialists beyond the facility, thereby ensuring continuity of care. All of this is set within an ambience that evokes the charms of boutique inn rather than the starkness of a hospital ward. Designing these environments necessitates a profound attentiveness to the voices of patients, families, clinicians, therapists, and caregivers. What apprehension do the patients harbor upon discharge? What challenges do family encounter in preparing their home? What operational frameworks do clinicians require to facilitate rehabilitation? Empathy-driven design workshops, prototype testing, and post-occupancy evaluation can eliminate friction points before they escalate into failure. After all, healing is not a linear journey, and neither should design be. The fundamental philosophy underpinning the transitional care design ought to be dignity. This is frequently the junction at which patient grapples with profound inquiry, such as, will I regain my ability to walk? Can I rejoin the workforce? Am I destined to become a burden to my family? Our environment possesses the capacity to address this anxiety, not through verbal reassurance, but through subtle cues of capability, comfort, and optimism. By empowering patients with autonomy, promoting mobility, honoring the necessity of rest, and enveloping them in an atmosphere of beauty, and compassion. We transcend mere assistance and recovery. We embark on a journey of restoring confidence. On the closing note, as designers, clinicians, and advocates, we must not underestimate the profound impact of the in-between. Transitional care transcends mere functionality. It serves as a launching pad for autonomous living and revitalized existence. So, on this note, I will be drawing the curtain of this episode. I want to thank you for joining me on Design for Recovery. If today's episode resonates with you, I encourage you to share it with your network, or even better, visit your nearest transitional facility and inquire, does this ambience evoke a sense of healing? And until next time, when we shall meet again, continue to design with intention and above all, design for dignity. I am Lowo Adeyemi. Bye for now.